All right, today we're going to tackle a health topic that honestly doesn't get nearly enough attention. We're talking about a type of cancer that's really good at hiding, but because it's so aggressive, it's something we all need to know about. So, let's just dive right in.
I mean, think about that for a second. What if a really dangerous cancer could be developing somewhere you look every single day, but you just don't see it? Well, for one rare cancer, that's not a what if. It's the reality.
And that cancer is oral melanoma. Now, you've definitely heard of melanoma on the skin, right? The kind we link to sun exposure. But this is a whole different animal. It starts in the same pigment-producing cells, the melanocytes, but inside your mouth, on your gums, your tongue, the roof of your mouth. And here's the kicker. Its cause isn't really tied to anything obvious like the sun.
So you might be thinking, if it's so uncommon, why the big focus? Well, that's just it. Its rarity is a huge part of what makes it so incredibly dangerous. Let's break down exactly why.
Get this. Oral melanoma makes up less than 1% of all melanomas. That is just incredibly rare. And because of that, most of us, and sometimes even doctors, just aren't on the lookout for it.
And here we get to the heart of the problem. It's sneaky. In the beginning, it might just look like a harmless dark spot, with no pain, no symptoms at all. But while it's going unnoticed, it can be progressing and spreading fast. That's why with this cancer, early detection isn't just important, it is absolutely everything.
Okay, this brings us to the most critical part of this entire conversation. What exactly should you be looking for? Let's run through the warning signs you really need to burn into your memory.
So, the number one sign is a dark spot that's either new or changing. We're talking about patches that could be dark brown, black, or even kind of bluish, showing up on your gums, tongue, or the roof of your mouth. And you've got to pay super close attention to the details of any colored spots. Do they have weird irregular borders? Does it look like it's getting bigger or changing its shape? Remember, any kind of change is a major red flag.
But it's not always about what you see. It's also about what you feel. Any weird pain that you can't explain, swelling that just pops up, or sores and ulcers that just won't heal. You have to take that stuff seriously.
And get this, even things you might blame on just regular dental problems could be a sign. Like if teeth suddenly start to feel loose for no reason, or if an area starts bleeding and you haven't injured it. These are clues.
So we've focused a lot on dark, pigmented spots. But here's a really important question, one that points to a huge challenge in catching this thing. What if it isn't colored at all? And the answer is a hard no. In some cases, these melanomas are melanocytic, which is a fancy way of saying they don't have any pigment. They can look like pinkish or reddish bumps, which, as you can imagine, makes them so much harder to spot and can lead to really dangerous delays in getting a diagnosis. Now, while we don't know the exact trigger, we do know some things can increase the risk. A family history of melanoma plays a role. So do long-term habits like tobacco and alcohol use. Even something like chronic irritation from poorly fitting dentures or having pre-existing dark spots in your mouth can be contributing factors. All right, so let's say you or your dentist find something that looks a little suspicious. What happens then? Well, the diagnostic process is actually very clear and methodical. It all starts with that initial clinical exam. If the concern is real, the next critical step is a biopsy. They'll take a tiny tissue sample. From there, you'd likely get imaging tests, like a CT or MRI scan to see if the cancer is spread anywhere else. And finally, that little tissue sample goes under a microscope for a deep analysis to get the final confirmation. As soon as that diagnosis is confirmed, everything pivots to the treatment plan. And what that looks like is really going to depend on the stage of the cancer and exactly where it is. The main weapon here is surgery, getting in there and removing the tumor. After that, radiation therapy might be used to clean up any remaining cells. Now, if the cancer is more advanced and has spread, that's when chemotherapy or immunotherapy might come into play. Immunotherapy is really cool. It basically supercharges your own immune system to go fight the cancer. Look, we have to be really direct about this part. The prognosis for oral melanoma is often not great. And the single biggest reason for that is tragically simple. It's usually just found way too late.
And this chart, this visual, says it all. I mean, just look at the staggering difference in survival rates when you compare catching it early versus catching it late. It is night and day. When it's found as just a small, local tumor, the chances are so much better. Time is truly everything.
So that brings us to the final and I think most empowering part of this whole thing.
Knowing all this is one thing, but taking action, that's what can actually save a life. So here it is, your ultimate defense plan.
It's really just a simple 3-part strategy. First, keep up with great oral hygiene. Second, and this one is non-negotiable, go to your regular dental checkups. Your dentist is a trained professional and is often the very first person to spot something that looks off. And third, take 1 minute every month to do a self-exam. Open wide, use a good light, and look for anything new or different.
So I'll leave you with this one last thought. Most of us are pretty good about checking our skin for new moles or spots that look funny. We've had that drilled into us. But be honest with yourself. When was the last time you took a really good intentional look inside your own mouth? It takes seconds and it can make all the difference in the world.